today we are going to discuss about a brief anatomical concepts about the nerves of the forearm. Now, when you talk about the vessel or the nerves of the arm, they are derived from the brachial plexus, and for all practical considerations, we can divide them into the axillary nerve, the musculocutaneous nerve, the radial nerve, the medial nerve, and finally the ulnar nerve. So, if you talk about these, we are going to concentrate on the nerves of the forearm, and we are going to concentrate on the radial nerve, the ulnar nerve, and the medial nerve. Now, when you talk about the radial nerve is known to arise from the posterior cord of the brachial plexus and has a root value starting from C5, C6, C7, C8 and T1. Now, what is important to remember in the story of the radial nerve is that the radial nerve has a course that is obliquely passing through the arm, and if you recall the concepts of anatomy, it was related with the humerus on the posterior aspect, and then later it comes from the posterior compartment of the arm to go into the anterior compartment of the arm, and thereafter it will now again cross to become from the anterior compartment of the arm to the posterior compartment of the forearm. So, posterior in the arm, anterior in the arm, posterior in the forearm. Now, the radial nerve is an important muscle supplier of the triceps brachii, and as I have said, it enters into the spiral groove to supply the nerve fibers of the triceps. Now, when it reaches into the forearm, it continues the journey between the brachialis and the brachioradialis, and then when it goes into the forearm, it will divide into the sensory branches or the superficial branches, which are mostly sensory, and the deep branches, which are mostly motor. So, there is a sensory branch and there is a motor branch of this. Now, when you talk about the sensory branch of the radial, this is usually provided by the nerve that arises from the radial nerve. So, this is usually provided by nerve that arises from the radial, as I have said, and it will be a posterior brachial cutaneous nerve. It has to be a inferior lateral brachial cutaneous nerve. It is posterior antebrachial cutaneous nerve, and it is superficial branch of the radial nerve. So, it is posterior brachial cutaneous nerve, it is inferior lateral brachial cutaneous nerve, it is posterior antebrachial cutaneous nerve, and superficial branch of the radial nerve. Now, these nerves are usually known to supply the various posterior aspects of the sensory aspect of the skin of the back of the arm. Now, the superficial branches were lastly going to supply the back of the hand, and so majority of this will in a sensory supply occur on the extensor aspect, to remember about this. Now, when you talk about the radial nerve, motor innervations, as I have said, majority of them will be supplying the triceps, anconeus, brachioradialis, supinator, and mostly the posterior compartment extrinsic hand muscles. Okay. Now, the injury to the radial nerve is usually associated with a wrist drop, and what is important is that there are various around deformities, particularly in association with the wrist drop, but majority of them will be in association with inability to extend the radial or inability to extend the arm. We come to the next nerve of concern. We will be talking dermatums at the end of the discussion of this nerve. we talk about the next nerve of concern, that is the ulnar nerve. The ulnar nerve has a root value around C8 T1, mostly usually from the and sometimes even 5 is from the C7. Now the ulnar nerve is known to arise and start from the medial cord of the brachial plexus. So it is starting from the medial cord of the brachial plexus. It descends in the posterior medial aspect of the humerus, goes posterior to the medial epicondyle, and it enters the anterior compartment of the muscles of the forearm and supplies the flexor carpi ulnaris and the medial half of the flexor digitorum profundus. Flexor carpi ulnaris, medial half of the flexor digitorum profundus. The ulnar nerve can enter the palm of the hand and branch off at the superficial branch and at the deep branch. The deep branch innervates the hypothenar muscles and the intermediate hand muscles and some of the thenar hand muscles. So they innervate the hypothenar muscle, intermediate hand muscle and thenar muscles. What are the thenar hand muscles? They are adductor pollicis, flexor pollicis brevis. So please remember that the main muscle supply will be intermediate hand muscles and the thenar hand muscles. There are superficial branches of the ulnar which are known to be sensory, and they also innervate the skin of the anterior and posterior medial no, it is not technically called medial aspect, it is the ulnar aspect of the hand. Okay, that is 1.5 digits and a very small muscle called as palmaris brevis. So this is all about what we are required to know about this part. In the anatomy part, you are required to know about the Guyon's canal and what are the problems that can arise due to a compression of this nerve. So in essence, ulnar nerve is the nerve for the hand and supplies the medial aspect. Now we come to the last nerve to describe about is the median. Now, but before we go to the median, remember that injuries of the ulnar nerve will be responsible for a deformity that is called as claw hand. Okay, so the claw hand has many points to discuss about and is usually associated with a classical deformity in which there is a flexion of the interphalangeal joint, there is an extension at the metacarpophalangeal joint, and these claw hand deformities can be a complete and a partial and association with the median nerve, etc. So in the anatomy part, we will restrict ourselves to discussing only the anatomy. The last nerve of concern is the median nerve, and whenever we talk about the median nerve, remember that if ulnar was the ulnar was the nerve of the hand and radial was the nerve of the extensors, the median nerve is the nerve of the forearm flexor group of the muscles. So to begin with, the median nerve arises from the lateral cord in a root value of C5, C6, C7, and so it is from the lateral cord, and from the medial cord you will get a C8, and from the medial cord you will get a C8T1. Now what happens is that the median nerve is known to pass down the arm in close relationship with the brachial artery. In front of the elbow joint, it supplies the muscles of the anterior aspect of the forearm. Okay, now and then when it comes into the hand, it enters to the carpal tunnel and then divides into the following branches. Now what happens is that the median nerve, when it comes in the cubital fossa, there is a nerve that comes out that is called as anterior interosseous nerve. Now the anterior interosseous nerve descends in the forearm now the median nerve is known to descend in the forearm, and when it descends into the forearm, it is now going to supply the muscles of the motor compartment, that is the muscles of the flexor compartment or the anterior compartment, except the flexor carpi ulnaris and the flexor digitorum profundus ulnar half. So what is important is that there are one important nerve called as anterior interosseous nerve. Now the anterior interosseous nerve has a very specific supplying the flexor pollicis longus, the lateral half of the digitorum profundus, and the pronator quadratus. So anterior interosseous nerve is a branch that is arising from the medial nerve and is supplying the flexor pollicis longus, the lateral half of the digitorum profundus, and the pronator quadratus. The medial nerve, on the other hand, as I have said, supplies all the muscles of the flexor compartment except the flexor carpi ulnaris and the ulnar half of the flexor digitorum profundus. Okay, now what is important also is that the rest of the muscles of the flexor, that means that and the lumbricals etc. are all supplied by the median nerve. Now finally, when you talk about and end about this discussion about what are the particular dermatomes that we are required to know about in the territory of each of these nerves. Now remember that when you talk about or draw a picture of 1, 2, 3, 4 and then we talk about the hand, and this is the anterior aspect or the palmar aspect, and whereas when you make a picture about this, the thumb 1, 2, 3, 4, please remember that I'll take a various colors very quickly. Okay, let me take up this color, sir, and then let us try to draw about the median. So remember that the median is known to supply this territory, 1 finger, 2 fingers and a half of these. So this is usually the supply of the median nerve, whereas some amount of this is supplied by, and then a half of this is supplied. So this is green colored is the median nerve. So let me write it quickly. Yes. Now let us talk about the ulnar nerve. Now when you talk about the ulnar nerve, as I have always said before, okay, 1 like this, okay, and definitely this is technically the area for the ulnar nerve, okay, and finally you have the radial. So the radial is mostly the nerve on the extensor aspect of the arm. So this is the supply of the radial. So this completes the dermatomal supply of the sensory areas of the hand. So this is all about the discussion about the nerves of the forearm, the radial, the median and the ulnar in a very brief concept making point.